Hello everyone, and welcome to this month's participant webinar. This is Gary Sams, the Chief Wellness Officer for Ebix Benefits Administration and Wellness, and our topic this month, and no pun intended, but this one's near and dear to my heart, is the new blood pressure guidelines and what it means for your health. And I'm thinking that most of you have probably heard, because it's been in the news quite a bit the past year, about these new guidelines that came out about blood pressure or hypertension. And the American College of Cardiology and the American Heart Association released these new guidelines. It was towards the end of 2017 actually, but people really started to talk about them, and they've become more commonplace here this past year. And they changed the hypertension limit or threshold to 130 over 80, and it used to be 140 over 90. And the reason why they did that is that, well, one new study said that if we were able to get people to achieve that lower level, in other words, to keep people below the 130 over 80, that it could prevent more than 3 million cardiovascular disease events over a 10-year period. So that's pretty significant, and that's our topic this month. We want to talk about these guidelines and what it means for us and how we can achieve better blood pressure control. So first, let's take a closer look at these guidelines. So what are they? And these are the new ones. Normal is less than 120 over 80, and I'll get into those numbers in a moment here about what they actually mean. Elevated is a systolic pressure between 120 and 129 and a diastolic pressure of less than 80. Stage 1 is a systolic between 130 to 139 or a diastolic between 80 to 89. Stage 2, systolic at least 140 or diastolic at least 90. And then the final stage, what they call a hypertensive crisis, is if somebody has a systolic blood pressure of 180 or over, or a diastolic over 120. And if that were the case, if you were getting your pressure measured, let's say at a pharmacy or something, a machine, and hopefully the machine is well calibrated and accurate, that's an instance where you definitely would want to have medical follow-up. Call your physician or hospital, and it's something that you wouldn't want to just let go when you're having something like a hypertensive crisis. And by the way, I just covered that very quickly, but I have a chart here in the presentation, if you're able to view the presentation, that goes into that in more detail. So those are the new guidelines, but let's take a step back and let's talk about what high blood pressure is. And first, blood pressure is a measurement of the force exerted against the walls of your arteries as your heart pumps blood throughout your body. And hypertension is a term used to describe high blood pressure. And as we just said, the new guidelines are if your pressure is 130 over 80 or higher, then that's considered now hypertensive. And untreated high blood pressure can lead to many medical problems. Obviously, we talk about heart disease, and I just mentioned that we could prevent a lot of heart disease instances with lower blood pressure. But it also is a risk factor for stroke, kidney failure, eye problems, and several other health issues. Those two numbers, the top number is called systolic, and that's typically the larger number. So in the guidelines, what we're looking for, let's say 120 is a normal and systolic blood pressure that we should shoot for, and the lower number is the diastolic pressure, and typically let's say that would be 80 or lower, a number that we should be shooting for. The systolic is the pumping pressure, and the diastolic is the filling pressure. But in general, again, this blood pressure is the pressure that's exerted on your arteries. And when that's high for a sustained period of time, that's where the damage comes into place. What are the risk factors for high blood pressure? That's something that we should know as well. And you're at risk. One, African Americans tend to be at higher risk for high blood pressure or hypertension. If you are obese, high blood pressure is also often linked to stress or anxiety or being anxious, so that can be a component. If you drink too much alcohol, and that's defined as more than 1 drink per day for women and more than 2 drinks per day for men. If your diet is high in sodium or salt, that can be a risk factor. If you have a family history of high blood pressure, if you have diabetes, and even smoking, tobacco use is a risk factor. But this last bullet is kind of important here, and this is where I said at the beginning, this is a subject near and dear to my heart. Most of the time, there's no cause of high blood pressure or no immediate or apparent cause is found. And this is something that's called essential hypertension. And actually this is something that myself and my family suffer from. So I have none of the risk factors that I just outlined. And in fact, I'm thankful that I practice a very healthy lifestyle. But now under these new guidelines, I would be considered hypertensive. So I'm working with my physician about trying to address that to make sure that my blood pressure is consistently near that 120/80 mark. But this is something that runs in my family, my uncles, my brothers, my father. It just seems to be an issue with us, even though we don't have any of the risk factors that I just described. So you've been diagnosed with blood pressure, high blood pressure rather. What can we do about it? Well, that's going to depend on the level of hypertension that you have. And something that I should have made clear at the beginning of this, your physician or provider, whomever you work with over on your health, is not going to diagnose hypertension based on one single reading of blood pressure. They're going to get multiple readings to make sure that this is actually what your pressure is, because most of us, or I shouldn't say most of us, but many of us have something called white coat syndrome, where when we go to the physician's office, we may be a little nervous or a little anxious, and our pressure can be higher than what it normally would be. And other circumstances can impact blood pressure. It can be fairly transient. It can move. It's dynamic. So they'll rely on several readings before they would actually, for example, put you on medication. But with that in mind, you know what your pressure is, and based on the level, these are some of the things that you can expect. If your blood pressure is between 120/80 and 130/80, that's just elevated blood pressure, and your provider will probably recommend lifestyle changes to bring your pressure down to a normal range, and medicines would be rarely used at that stage. If your pressure is higher than 130/80 but lower than 140/90, that's that stage 1 hypertension. And when thinking about the best treatment for that level, you and your provider would consider things like other diseases that you might have or risk factors, and more than likely the provider would recommend lifestyle changes and have you come back in a month or two and repeat the measures to see what the impact has been. If your pressure remains above the 130/80 but lower than 140/90, your provider may recommend medicines to treat high blood pressure. If you have other diseases or risk factors, the provider may be more likely to start medicines at the same time as lifestyle changes. And finally, if your pressure is higher than 140/90, and that's that stage 2 level of hypertension, your provider will most likely start you on medicines right away, as well as recommend lifestyle changes. So what about lifestyle changes? Of course, we always want to take control of things that we can ourselves and make that our first effort prior to medicines. So what are the lifestyle changes that you can make to help make an impact on your blood pressure? Well, those include things like eating a heart-healthy diet, including getting enough potassium and fiber, drinking plenty of water. Being hydrated makes a difference, particularly because we'll talk about sodium in a minute. Get at least 40 minutes of moderate to vigorous aerobic exercise at least 3 to 4 days per week. So this makes a big difference in your hypertension. If you smoke, quit. Limit how much alcohol you drink, and we've already mentioned 1 drink per day for women, 2 drinks or less for men per day. Limit the amount of sodium or salt you eat and aim for less than 1,500 milligrams per day. And the key there is to look at the processed foods that you eat. Many of them are pretty high in sodium, so try to eat whole foods, cutting out a lot of the processed foods. Reduce stress. Try to avoid things that cause you stress, and if you're under stress, try things that we've talked about before in other programs like meditation or exercise, relaxation techniques. We have a program called Relaxation Hacks now available in the portal. Try some of those things to reduce your stress and try to stay at a healthy body weight. So in conclusion, thank you for your time and attention to address this important topic. Our blood pressure guidelines have changed. We're now trying to get people to stay at a lower level than we did in the past, because what we found that lower pressure can make a significant difference in your risk for heart disease and heart related issues. So it's something that we should all aim for, and as I just mentioned, by making some lifestyle changes, that's the first order of business, and you'll get benefits beyond your blood pressure when you do those types of things. But if needed, there are many medications and other things that are available to help address hypertension. So something that we should all be aware of. Thank you so much for your time and attention. Look forward to speaking with you next month.